bilirubin, which is, if you described it in the video he posted, that it's a byproduct of your liver, and it wasn't getting cleared, and so that's what kind of started us down the liver stuff. So I'll let Dr. Bills talk about that.
So we know Doc has had liver disease for a long time, and patients with cystic fibrosis can have cirrhosis, which means sort of permanent scarring of the liver for many, many years, but their livers still function okay. But unfortunately, sometimes after a period of time, your liver starts getting sicker, and where it can't do the things that it's supposed to do. So the liver is what helps us clear our bilirubin and clear toxins in our body. When the liver starts not working well, your bilirubin goes up, and that's what causes the yellowing of his skin, and just his liver, we know now, is not functioning well. So while he's been a very, what we call stable cirrhosis, he's now decompensated cirrhosis, where his liver is now actively failing. The really sad thing is we don't have a medicine or treatment as far as medicines to help stop that. Over a period of time, the liver fails, you can unfortunately live without your liver. So that's what has led us to some discussions, and I know you have some questions from a transplant standpoint.
Does that make sense?
Mm-hmm.
Okay.
And I think sort of what we've talked about with your lungs being sick from just your CF, and then also your liver being sick from your CF, you can't necessarily do isolated transplants, like where the only treatment that we would potentially have for a liver would be to do a liver transplant. But sometimes when your lungs are too sick, you can't do a liver transplant without the lung transplant. And when your lungs are the way they are now, you wouldn't survive a liver transplant without getting the lungs. And so that's why we've sort of shifted this discussion to liver.
Yeah. I think if your liver was still okay, we wouldn't be talking about lung transplant at this point. We still have time, but it's a different ballgame when the liver fails.
Yeah, because I know the bilirubin numbers are supposed to be at 1, now they're at like 30 something.
Right.
So.
Correct.
So your levels have been pretty stable for years, around 1 to 2. Sometimes when you come in the hospital, they bump a little bit higher, but they get better. And then when you came in, when you noticed it, I think before his level was at about 10 or so, I believe, when you came in. And now it's just this last weekend, unfortunately, taken a really big jump. We've gone from like the 10s to maybe 14, all the way up to the 30s. So that's sort of where we're seeing things right now. Like we had talked last week, sometimes when your liver gets sick, you start to have other complications or other symptoms. So you know about sort of the fluid in your belly.
Which is basically gone at this point.
So some of the medicines that they have started have sort of, like we had talked, sort of help you try to pee out some of that fluid. But when your liver's sick, you can't hold on to the fluids in your blood vessels like you're supposed to, so it sort of seeps out. And that's where some of those medicines can help. Sometimes that you have to add more medicines to control that, and then sometimes have to have a procedure where they, under anesthesia, put a little needle in to help release the fluid. Other things from a liver standpoint we think about is, I think the team might have talked with you today, or we talked last week, sometimes when the blood can't get through the liver really well, it sort of backs up and makes your spleen
Into the
grow big,
spleen.
but also backs up into, you have these blood vessels in your esophagus or your food pipe, and those blood vessels get real juicy.
Yeah, they were just talking about doing something with little rubber bands.
So in kids, we don't go looking for those with a scope unless you actually start having like vomiting blood. But once you're 18, the criteria changes where they actually go look for those things. Because if they are there, then they can put a rubber band around that juicy vessel and try to get that to go away, just to try to limit a problem with vomiting blood or bleeding, because that can be very, very serious, especially when you're sick. So there's other procedures and things that would happen to try to help limit any kind of complications or other symptoms that we know a lot of times can happen when your liver gets sick. I know this week too, they've been watching your kidney numbers, and sometimes your kidney numbers get off a little bit. Sometimes that can happen just from sort of going up exactly. Sometimes that can happen because of the medicines that we use that help to get rid of that fluid. And that's hopefully and probably what, and we're working to control that. But sometimes when your liver gets sick as well, your kidneys also get sick just from your liver being sick, because you don't see as much blood going through the kidneys and doing what it's supposed to do. So sometimes we'll start to see kidney issues as well.
I know we had just met like moments ago, but I'm Dr. Tika, I'm the liver fellow, so I'm working with Dr. Kozik and then Dr. Mollison, who I think you guys have met maybe before.
And then Dr. Tolliver has been the doc the last 2 weeks on the liver team that is.
So, options at this point, right? So you've heard about the fact that liver is really sick because your lungs aren't the best shape. We'd have to do them both if you want to do a transplant.
Yes.
The other option is just to do comfort care. Okay. I just want to make sure you understand that that's an option.
I want to do lung and liver.
Okay. So they've not done that here.
Right. I have to go to Cleveland, Ohio.
Probably. We're gonna ask, but I guess logistically, I didn't know this until today. The lung transplants are done at Methodist. Liver transplants are done at Uni.
Yeah.
2 different places. I didn't know that because I've only had experience with the lung side.
We didn't know that either until today.
Yeah. So now you know. So I don't think it's gonna work out. I don't know that you'd want to do that anyway. You'd be the first person to do it here. That sounds kind of scary.
Yeah.
So Cleveland has way more experience. It's not a huge number because not a lot of people that need both, but they still have probably the most experience. So the thing is, we don't know for sure how this is all going to work. So we have to ask them first if that's what you want us to do.
Yes.
Would they take a look at you? So there's a bunch of steps from a liver standpoint for transplant that they know more about than I do. From a lung standpoint, usually they want you to be in pretty good shape nutritionally, taking all your meds. Obviously you won't be on any of the ones that affect your liver.
Well, I've been taking all my meds. Haven't really been eating because, well, it's a lot of news, a lot of bad news, and so you get a little not hungry.
Yeah.
But
Sometimes they'll have you apparently do like an NG tube.
oh, what?
A tube that goes down into your stomach so they can...
Oh, like a
dump
G
form-
tube, but through the
Not like a
mouth.
G tube. Through your nose.
Oh,
So it's the same place in the end, you're right.
yeah,
but
it's
goes through
similar.
your
It just
nose.
goes through a different place. Yeah. Okay, got it.
Doesn't require surgery.
Okay, I
Okay.
think so.
Just sits there in your nose, a little uncomfortable.
Yeah.
My kids that have done lung transplant before, they usually make them do like some sinus surgery stuff. There's pulmonary rehab that you have to attend. Make sure you're in as good a shape as possible.
Yep. Catherine
And-
has covered all that.
Yeah. So you've talked to them. So I don't know what Cleveland's program is like, but I'm assuming it's pretty similar.
Yeah.
Okay. And then liver ones.
Yeah, from a liver standpoint, most of the evaluation process is kind of doing specific blood tests, doing specific imaging tests, and then one of them is getting that scope done, like we just talked about, to make
Easy.
sure you know about the variceal bleeding. So our stuff tends to be a little bit more straightforward from the stuff we have to do to you. There's usually a couple of things that are kind of center specific in terms of what they hope to get back from you in terms of like keeping up with labs, hopefully keeping up with like nutrition and some of the kind of making sure you're as fit as possible to do a big surgery like that. And then kind of committing to always sort of being in communication with the team.
They also sort of look at just lots of different things. As we had talked beforehand, they're sort of, at least from just a liver, it's probably a little bit different from a combined liver lung. There's several steps to when you're looking at the transplant process. And so the first step is somebody eligible to undergo the actual evaluation? So that's like getting through door A. And they look at one, sort of how sick your liver is, how sick your lungs are. One of the really big things they look at is compliance, as far as have patients been compliant with their medicines and taking the medicines.
getting a lot better at that.
Because unfortunately, if you don't take medicines when you get a transplant, your transplant fails.
Yeah,
Like, you don't
instant
learn that.
refusal.
So it becomes, some centers require, a lot of times if there's been some issues with compliance, a time period where there are no missed meds, no missed feeds, no missed appointments, no missed labs, like across the board, before they'll even say, hey, yes, now we can go through door A. Sometimes then, once you go through door A and then get all of those things done, like Dr. Weiss talked about and Dr. Tika talked about, then a whole team sits together with pulmonary doctors and liver doctors and social workers and pharmacists and ID doctors and all kinds of doctors sit together and sort of look at everything and look at sort of options. And then, so that's, then you'd go to part B, and if they, at any point that they could say, unfortunately, I'm just not a candidate to move forward, or they could say, yes, this is a candidate, and then you would be listed. And then once you're listed, then it's sort of waiting for organs to be able to become available. And then step C is the big door, is actually getting organs.
Mhm.
So there's lots of steps to sort of go through and to require before you can get through each of those doors. But like we had talked about, we talked to see what our options are.
Yeah, we've not actually talked to Cleveland yet because we didn't know.
Yeah.
So we have to figure out, do they want us to directly send you there? That'd be the fastest way to do it.
Mhm.
But I don't know if they will allow that or not. We have to talk to them first.
Yeah.
And then a lot of transplant centers want you to be pretty close.
Mhm.
And, you know, I don't know what the distance is from North Vernon to Cleveland, but it's more than 4 hours, which
It's
I
like
think is
what,
the
6?
It's like 5 or 6 hours.
Yeah. So they may have some resources to help you guys in terms of living there, but they probably, if they think that you're a good candidate and they're willing to do it, they probably require you to live nearby.
Okay.
Do you have any family?
No.
Sometimes that means too that like your lung care and your liver care doctors would all transfer, even pre-transplant,
Right.
to that center. There's lots of ifs out there, we don't, but it's just sort of letting you know sort of what we do know
Right.
and sort of what things could look like.
So what questions do you have specifically?
Me, about these topics right now, I don't have any.
Okay.
It's all been pretty well explained over the past couple of weeks.
Okay.
I don't know what they have though.
Yeah, sure.
I don't have any questions.
Are you sure? Okay. Dan?
If the surgery and all that stuff, the transplants and whatnot does take place, is there about how long for the recovery would be, I guess is what I'm asking.
Yeah. I don't know from
I know most of it will be depending on how his body
Yeah,
accepts
it
the
really
organs and
does.
everything. I just didn't know
Yeah.
if it, 6 months, a year, 2 years, kinda until,
Yeah. I've had 2 kids with CF. Their brothers go through lung transplant here. They were adults when they got it. One did great, sailed through everything, is doing great to this day. The other one had an immediate post-op complication with his lungs and didn't do as well and eventually passed about a year after the transplant. So even though, they have the very same genes, same family care and everything, they had very different outcomes because he had an unfortunate surgical problem that nobody could have known about. So he was in the hospital longer. The other guy got out fairly quickly, and like I said, he's done great.
So it kind of all just depends on how your body reacts afterwards.
Yeah, and it's obviously more complicated when you're getting 2 organs.
Yeah.
So
there's no
it
real
could be longer.
placement time for how long the recovery can be.
I mean, Cleveland may have an idea, but
Yeah.
it's always dependent on how you do.
Yeah.
Right? So.
Yeah, that's true. I won't even venture to guess anything because it would be really different. There's a big variety in folks who just get a liver, and I think getting 2 organs changes that quite a bit.
right?
So that's a good question to ask them. if they give a time frame to people, they may not, so. Okay,
Just in general, after huge surgeries like this, it usually takes months for people to kind of start to feel okay. But there's always complications and things like that that can change that time frame.
although oddly with the lungs, a lot of people wake up after they're extubated and feel great because you have lungs that don't have any problems. So a lot of people with CF feel really good after the surgery. It's just all the post-surgical pain that you have to manage.
Mm-hmm.
So. All right, Bryan, you have any questions? No? I don't know your name.
My name
Ian,
is Ian.
Ian, you're just the cousin. I know the cousin for years and years.
That works. What's the percentage of success with something like this?
I don't know the statistics because it's pretty rare. So I think they're the center that does the most of them, so they would be able to tell you what their success rate is, but I don't know the numbers off the top of my head.
Yeah, I don't either. That's something that we can look up though,
Mhm.
just because all transplant centers have to kind of report their stuff, so we can look into that number for you.
my only questions are completely different topics.
Okay, well, what are they?
Go for it.
The first one is I have a service dog, Falafel.
You name them falafel.
First letter of both our previous dog's name. I was wondering if she could come down to the lobby, and I could at least see her for a couple
I thought
minutes.
service dogs were allowed.
Not on the plum floor.
Not on the phone. I've been talking with Dr. Averill and we are working on it.
Okay.
Did they swab your nose?
Not yet.
Yeah, okay. Make sure that that's right, because we're 3 weeks out from our rhinoenterovirus positive for rabies, so, yeah, we can get that off your chart, then we can get you out of trouble. And even if we can't, I feel like we can find a way.
Yeah.
We can find a way to make an exception even if it's still there.
Yeah, I would think so.
My other question is before all the transplant evaluation and stuff over
Yep.
in Cleveland,
Yep.
can I leave for one day, then come right back
I don't know.
to do at least one thing?
I hope so. But if they want to transfer you to hospital, then we wouldn't be able to do that.
Right.
Right? So it depends on what the time frame is from their end. So,
Okay.
but I would hope so. But if it's going to bump you up in terms of the eval, it'd probably be worth it staying here.
Right.
I don't know what the one thing is you have to do at home, but
I don't have to do it. I just really want to.
sure.
It's like number one goal I want to do before I, die or do something very, very risky.
Okay.
But very, very risky. You just made Dr. Bosik's heart rate start.
Oh, just a quarter mile.
A what?
Skating?
No. A quarter mile is where you're in a car.
Oh my.
He wants to take a lap.
Well, it doesn't have
He
to.
wants to go fast
Oh,
in the car.
170-ish. It's only 10 seconds. You get in the car. I'm gonna be the passenger to a
Who's
professional.
Okay.
Not him. Who is it?
Wrong cabs.
Yeah.
Does he do this professionally?
Yes, he actually did a race for Napa. So.
Oh, okay.
So yeah, I'm gonna be his passenger. And we're gonna go the length of a quarter mile, which is very short, in 10 seconds.
Where at?
Random road.
Either on a track or this very decent road I know.
thinking
It's not
airport
a
road.
I don't want to hear any more details.
He's got plans.
You better be on a track. I hope.
Right on safety.
Mhm.
Well, you practically do that with your snow. What is it? When he's driving truck?
Snow runner.
Oh, the
Snow
snow runner. Yeah, Dr. Weiss does not want to ride with him driving.
No,
No.
I've seen him drive over boulders and people.
What do you mean? That's so fun.
Yeah.
Yeah.
Okay.
Funny part is I'm a better driver than you.
Yeah.
What else? Stevie, you have to have some questions.
I think they've been answered.
Okay. I think, unfortunately, a lot of it sort of depends on what Cleveland says too, so it's hard
Yeah.
to say.
Right now, all of our questions have been answered apart from things that
that.
can only be answered in Cleveland.
Yeah.
Okay. All right, well, we'll contact them. And Dr. Averill has been talking about the home side of things here, so we don't have a definitive answer, but if they said yes, and the liver people here said yes, which is a very tiny percentage possibility, would you want to try and stay here?
Yeah.
Okay. All right, so we'll find that out first before we contact Cleveland. And we'll make sure it's truly not possible here before we pursue
Right.
going out of state. Okay. All right.
I think while we're all here,
Mhm.
it does need to be mentioned though, if they both say no, I think that is a conversation that needs to also be brought up with you guys and what your goals are for the future. So I want to be realistic in saying that that is a possibility. And so Paladin is here because of that and for any other questions you guys might have about if that is the route we do end up taking, if you guys end up having questions about.
Not really.
So if they do, so if they don't say yes or whatnot, then what's his path kind of from there?
Just kind of living my life till
Yeah.
however long I go.
That's up to Dockland at that point. So if he doesn't want to be in the hospital and he doesn't have to be in the hospital for any particular reason, then I assume you want to go home.
Mhm.
Okay. And if the worst happens and you're close to passing, do you want to be home or do you want to be here or somewhere else?
I want to be home.
Okay. That can all be arranged.
And I hear that your goal is to get to transplant. I think we all are hopeful that that would be something that you can pursue. But our team will be here to help support you no matter what happens if that's not a possibility. And I think you're exactly right that our goals then would shift to the things that are most important to you for whatever time we have, and we maximize all of that. And so we can help arrange services to make sure that you can be at home and have the support you need.
Mhm.
Okay. I'm happy to talk more about that, but I also acknowledge that I hear our primary goal is to move in a different direction, and that's my hope. To do that. So it probably makes more sense to wait until that time comes that we can have a conversation. But I think it's a really good thing to just be aware of that if things don't go the way we're hoping, then we'll have to talk more about what we do then and how we make sure that life looks as good as it can for as long as it can.
Race cars.
I was gonna say. Terrorizing North Vernon streets.
Mhm.
Oh yeah, that's my kid.
This is super hard to have all this uncertainty and I wish that this was just all more clear.
I'm a better driver than I am in GTA, don't worry.
I would hope so because you're a terrible driver in GTA.
Oh yeah, I know.
She drives better than you in GTA.
I know.
And I don't play video games, so that's bad.
It's fun to drive horrible though.
Only when you're in the desert you can make giant jumps.
You got in the city too.
All right, anything else?
Just one more thing.
Mm-hmm.
Could I get, what was it called? A living will?
Yeah.
Is that what you said?
Yeah, he's been, like, he asked me what's gonna happen to all of this stuff, and
Uh-huh.
I told him that was up to him, and they have what's called a living will where you can figure it out now if you wanted, and
Yeah, I'd like to get one of those just in case.
I think the living will is more like what you want to have happen, right?
Yeah.
I think a living will can include a couple of different things.
Oh,
It
okay.
can
I
include
didn't
some
know
of
that.
that information, but what we can do is maybe my team will circle back with you early next week. Our social worker often helps people kind of sort through some of those things. I think that makes a lot of sense, but I think there's probably some other things that would make sense even just going into this process. You know, making sure that we have in writing who makes decisions if there's a time where you can't and things like that. And so I think there's probably a number of things that are similar that would be helpful to talk through. Is that okay if we kind of stop
Yes.
by early next week? Okay. Make sure we do that.
I think that's all from my side.
Those are really good questions.
We're thinking about good things.
Okay, we'll hopefully hear from IU maybe today. If not, Monday. And then we'll contact Cleveland. Dr. Schmeel's on next week, so he, of course, is very versed in CF stuff. I'm in Evansville, but available by phone.
Mhm.
And then I think Dr. Bozaker's next week, towards the end of the week. But Dr. Molliston will be around. Yeah. Okay.
Mhm.
You've met Dr. Schmeel.
I most likely have.
Can't forget him.
Yeah. You'll know when you see him.
You guys are stuck with me for 2 weeks.
Oh, Lord. No, I'm kidding.
Okay. And if you think of anything, write it down. And it goes for you at home too, because it's easy to get in front of a bunch of people and forget what you're
Draw a
going to
blank.
ask. Yeah. So we always tell people to write stuff down, because that way you've got it handy and you can ask your questions. And if we don't know the answer, we can find somebody who does know the answer. Okay?
Mhm.
All right. Thanks for coming. Anybody else have anything else they want to add?
I don't know how to throw a party around here, huh?
Hoping for the best.
We can bring people down. I just don't want to know any details about the drive.